Hi, I'm Dr. Marty Ross. In this video, I talk about marijuana and CBD, and I describe the differences between these two chemicals. I also talk about the conditions that they can treat. I describe the various ways that you can take them. Vaping, for instance, is different than using them as an edible. And finally, I describe whether CBD is a useful Lyme disease antibiotic. Treat Lyme is supported by purchases you make through Marty Ross MD supplements.
This is from Sherry. Hi, Sherry. Let's see. What are your thoughts about CBD oil and treating Lyme? Does it help pain, fatigue, any other benefits to using it? So, Sherry, there's actually, as many of you know, before moving here to Austin, Texas, I lived in Washington State, which is where I practiced until the end of 2018 treating Lyme disease. And Washington State is a state that allows marijuana for a number of reasons. First of all, there's a recreational marijuana law. And also there is a medical marijuana law. We've had one of the original medical marijuana laws in the country. So I'm pretty well, I have a lot of knowledge of working with marijuana and CBD. The thing I will tell you about medical marijuana and CBD is we really don't have a lot of research. And the reason for that is the federal government has blocked effective research. But based upon research that's been done in people with multiple sclerosis, for seizure disorders, people with HIV and AIDS, a number of other illnesses too. There's some things that we can kind of learn about medical marijuana and CBD, and I'll talk about those here in just a minute. Okay, all right. So first of all, what is the difference between marijuana and CBD? Let's talk about that first. Okay, so CBD is a chemical that is found in cannabis plants, and THC also is a chemical found in cannabis plants, okay? Now, something is technically called marijuana if it has more than 0.3% THC, the chemical called THC, okay? All right, now THC is what gives you that marijuana high, okay? That's what people are doing when they're smoking marijuana. That's the chemical that gives you the high. CBD, on the other hand, does not give the high, okay? Now, they both interact with something which is called the endocannabinoid system. That's a mouthful. So basically, we have our own marijuana chemical system in our body. Our bodies naturally make marijuana-like chemicals. And that's part of something called the endocannabinoid system. All right. And there's two major chemical receptors. THC that you get in marijuana binds to the CB1 receptor, I believe. And then CBD actually doesn't bind to either one of those receptors. All right. So what it does, CBD helps to block reactions in the body that break down our own natural marijuana chemicals. Okay. One of those is something called anandamide, and there's another one called 2-AG. Those tend to be the two major chemicals that we make that regulate our endocannabinoid system. All right. So when we're talking about marijuana, we have to realize that CBD is not equivalent to THC, all right? Because they act differently. THC binds to the CB1 receptors, and the CBD itself doesn't bind to either one of those receptors, but rather it helps elevate the natural body's marijuana chemicals, if you will, that interact with those receptors, all right? All right, so there's two, that's one point, okay? Secondly, THC is what tends to give you the high, okay? It does the more mind altering than what CBD does, all right? It tends to be more sedating as well too, okay? So when we're talking about one of the things that you can use THC and CBD for is sleep, all right? But to be honest with you, what's going to work better for sleep is something that has higher amounts of THC relative to CBD, all right? Now, in Washington State, you could go into one of these medical dispensaries and tell them, I want a mix that has 70% THC and 30% CBD. All right, you can actually do it that way. I'm not sure if the dispensaries in Colorado work that way, but basically, if you're wanting something stronger, for sleep, err on the side of THC, okay? All right, now, one of the problems with THC that I have to warn you about is it can lead to depression in some people, and it can sometimes cause more psychiatric problems, all right? Now, I just want to let you know there's a potential of that. On the other hand, both THC and CBD can help with depression and anxiety. They both can, all right? Both can help with pain, Both regulate pain in different ways, but both are quite effective against pain. Both can help limit seizures. Both can help make it so that if you have a lot of salivation problems or making too much spit, like people get with Lou Gehrig's disease, ALS, they both can limit that as well too. Okay, so and they can help you deal with nausea as well too. All right, so there's a variety of benefits of the two. One is that they might help manage anxiety and depression. The other is they both can help manage sleep to a degree, although THC is stronger. Both can help manage pain to various degrees. And both can help with seizure disorders, or may help with seizure disorders, I should say. Okay, and both can help with just general body pain. Those are the big reasons that I look at using either THC or CBD. All right, then the little nuance differences. If you happen to be able to get CBD and it doesn't work for pain, sometimes THC works better. Something that's richer in THC may work better, okay? CBD is more accessible these days, though, because it's legal. The federal government it appears to be legal at this point, although the Trump administration has been making some remarks about it. But at this point, CBD is technically legal to get, and therefore it is much more accessible. THC, stuff, medical marijuana that is rich in THC, is harder. You have to be in a state that allows you to have medical marijuana, basically. Fortunately, I think there's around 23 or 24 states in the country now that allow that. Okay? All right? There's different ways you can take these chemicals too, all right? And how you take it affects how it's going to work in you, all right? So if you have an edible, if you are a person that likes to eat marijuana cookies, for instance, all right, or CBD oil mixed in food, that's going to slow down its absorption. And so the effect of taking it may hit about 2 hours later after you take it, but it will last longer. It can last, I think, up to 7 or 8 hours. Okay, all right? Another way, but then that makes it really hard to regulate what your dose is, all right? So another way to do it is to either smoke or to vaporize it. Those, because you're breathing the chemicals in, get absorbed quickly into the bloodstream. And if you take it that way, usually within 30 seconds to 2 minutes, you have a pretty good idea of what the level of that is going to be. Okay, so you can get vaporizer oils, you can take it in by vaporizer, you can smoke it. Okay, all right. There are some people that advocate using CBD and even marijuana to treat Lyme. A lot of that. There's been some preliminary work looking at that by a physician up in Canada called Ernie Murakami. And Dr. Murakami helped spearhead some Petri dish experiments that tried to see could CBD be useful, basically. And those experiments did show some good killing effect of Lyme in the lab. However, what I will tell you is what goes on in a Petri dish does not always mean it's going to work that way in a living person. And in this situation, having worked with medical marijuana in Washington State, I don't think that I would call CBD and marijuana the best Lyme germ killer. I think it's more effective as something we use to treat various conditions that can occur in Lyme disease. Okay?